My name's Michelle Vassallo and I have been in the massage profession for around about 17 years. I came to massage as a sea change, so I was in my 30s when I came into massage. I was studying at uni and I did manual lymphatic drainage, which is a specific subject we have to do in the diploma. And I went into the first class and walked out of the first class and decided I was never going to do that again. I actually even rang the teacher and said, I'm not coming back. So thank goodness that I listened to her and I respected her and I did come back, because I went on to specialise in manual lymphatic drainage, specifically because at that time there was nobody really doing it. So there was a lot of people doing remedial massage, but I needed an edge, I needed something to specialise in. And I practiced a lot of that, saw the results and realised that there's a great way to teach this. So manual lymphatic drainage has got to do with accessing the lymphatic system and working out how to work with the lymphatic system to increase tissue health and well-being for the client at a cellular level. Manual lymphatic drainage can be integrated successfully with most other massage modalities, and it's something that can be taught as a standalone routine, but it can also be used as a little part of each treatment, which will help therapists to get better results for their clients and also help therapists to work smarter and not so hard. So thank goodness I followed my teacher's advice, otherwise I wouldn't be here. I love teaching manual lymphatic drainage, it's my passion. And I've been all over the place and taught hundreds of students this technique. And I'm still getting emails from people telling me how it's working brilliantly in their clinic and how they're using little parts of it when a client doesn't want a full routine, really successfully, particularly with post-operative, pre-operative, sporting injuries and all sorts of illnesses in winter to boost the immune system. Back in 2009, I was invited to go to Canada along with a couple of my good friends to teach for a couple of the associations over there, and basically I've been back to Canada every year since then. My specialty when I'm over there is lymphatic drainage, and the bonus is Canadians love the Aussie accent. So I get to hang out with some amazing students in a beautiful country and share this modality not only at home but also internationally, which is fantastic. If a therapist is interested in getting into lymphatic drainage or potentially studying it or adding it as a modality to their toolbox, the first thing that they need to consider is, are they prepared to take a step back from everything that they've learned so far and learn something that's totally different? Totally different in terms of timing, working very slowly, one stroke, one breath. In terms of pressure, are they prepared to go home and do some homework, like taking an egg out of the fridge that's not cooked and rolling it across a bench top? Because that's exactly the pressure that they're going to have to use in their lymphatic drainage. And also working towards the lymphatic system. So they're working in a different direction to how they normally would in a remedial massage. So is that therapist prepared to take a step back, learn something new, slow it right down, and treat their clients to a different kind of experience that'll benefit the client, but also the therapist? Because let's face it, massage is hard work and remedial massage therapy is hard on the body. And so if we can find a technique to integrate that's actually going to be a lot easier for us to deliver, that's a smart move professionally as well. Recently, I've become interested in working with palliative care clients and also end-of-life clients, and this stems from an experience that I had in my massage room many years ago, where I was using manual lymphatic drainage to treat a client who was actually in end-of-life care. And her passing affected me profoundly in so many ways, but also the work that I was doing with her and the fact that I could use lymphatic drainage with her to ease her suffering and to increase her quality of life for the days that she had left was really profound. So I started thinking about how could I integrate those two things, and how did I define what's palliative care and what's end-of-life care. And in the beginning I kind of thought they were the same thing, but as I did more research I realised that they're not. So palliative care is an approach that aims at improving the quality of life of patients and their families, and it looks at patients with life-limiting or life-threatening illnesses, and it looks at all the different ways of incorporating education and excellent assessment in terms of physical, psychological, emotional and spiritual well-being for that particular client and the families that are involved in caring for them. End-of-life care is different, although the two terms have been blended in some ways. End-of-life or hospice care, as Frank Ostaszewski talks about in the Sam Harris podcast, Waking Up, he talks about how hospice or end-of-life care is dedicated to caring for the client in their final weeks or months of life. And quality of life is actually the aim here, not getting the client into any kind of situation where there's more tests or more treatments. We're not looking at they're getting better. We're looking at creating comfort and ease for end of life and end of days. And usually that's got to do with administering pain relief as probably the main thing, and also being in that space and sharing the client's wishes and thoughts, and if they want to talk about the situation that they're in, and assisting them to have some kind of verbal platform to share with you. So those two things, although they're blended in literature, they're actually quite different. There's two different sort of scopes of practice here. So I do teach palliative care. It's the palliative connection, and there's three parts to that. So I look at how do we have the attitude in the West to death and dying, and what do we think about it, and how do we deal with it, and how do we not deal with it. And then the second part looks at the palliative landscape in Australia and what sort of access do people have to services and things that they might need. And then the third part looks at how to integrate massage therapy, in particular lymphatic drainage, into that landscape. So there's three parts to that, and lymphatic drainage comes in right at the end. So to talk about massage, because although the evidence base is not compelling, the fact that so many hospices and palliative care centres are taking up massage therapy as part of what they offer shows us that there is some kind of anecdotal evidence base for the benefits of that particular treatment. And the reality is that manual lymphatic drainage probably works just as well, if not better, than a whole lot of other remedial techniques, because by this point in time, it needs to be gentle most of the time. So that's why manual lymphatic drainage is an excellent adjunct to care in a palliative and also an end-of-life environment. What we're kind of wondering, or the question was, how do we integrate, or how successfully can we integrate manual lymphatic drainage with end-of-life and palliative care? And the reality is that the physiology of the lymphatic system and the application of lymphatic drainage successfully can treat many of the conditions that are associated with end of life for clients. So things like nausea and sleeplessness and anxiety and stress, and some of the other physical effects that come with end of life. So a bit of the edema that may be due to medications that people are on right at the end. So manual lymphatic drainage is so light and gentle, but it's actually profound because it can treat some of those conditions that are the things that are limiting the success or the quality of life at the end of life stage. So the question is, how can we talk to massage therapists about potentially wanting to go into working in the end-of-life or palliative care space? The thing that I would say, first of all, you can't work in that space unless you can face your own mortality. You've really got to sit down, look at your views about death. How do you sit with it? How do you feel about it? How many experiences have you had in your life where you've come into contact with somebody who's dying or has died? Who do you know? Who have you talked to? How willing are you to discuss this topic? Because it's going to be a really hard environment to be in unless you're willing to face your own mortality. And in doing so, the gift to you, if you can face your own mortality, is that you'll live better. Because you know that it'll end, you're going to grab the bull by the horns and take life and live it. So that's really the first port of call. And then if you decide that you want to go into working in palliative care and accessing that environment, be prepared to listen to the client that you're working on without judgment or control. By this point in time, there's not much that you can do to change their picture, but what you can do in that transition when they need human contact the most is listen to them. Without judgment, without trying to change the outcome, without any kind of control, give them your ear, because in doing so, you're helping them with the greatest transition. And, you know, it's a great big, I won't say bonus, but it's a beautiful blessing to be invited into that space with somebody who really needs human contact in order to transition successfully. So it's a privileged place to be invited into or to choose to work in, but face your own mortality first, work out where you sit, and then work out whether you can successfully hold space without control and judgment for somebody else's transition. Hi, it's Michelle again. Don't forget to click the subscribe button and ring the bell so that you can be notified of all my new videos. I'll see you in the classroom or online again soon. Bye for now.